Thank you for being here. This is bringing conversational intelligence to healthcare. I'll go ahead and get my introduction out of the way. It'll be short. I'm Bradley Metrock, CEO of Project Voice. We bring a lot of content and community to the world of conversational AI. I'm general partner of Project Voice Capital Partners as well. Take a moment, tell us who you are, tell us what you do, and tell us who you do it for.
Certainly. My name is Yaa Kumah-Crystal. I'm a pediatric endocrinologist and informaticist at Vanderbilt University Medical Center in Nashville, Tennessee. I've been a big Brad fan for a long time, involved in the voice space and voice user interfaces and generative AI. So trying to better understand how we can leverage these tools to improve the care we deliver to our patients and decrease the burden we have on our medical staff that's been growing increasingly over the past few years.
Well, yeah, and give us an idea of that, because even being an alum, I don't know, what is the size and scope of Vanderbilt University Medical Center and the medical operation?
Oh, goodness, ever growing. So we have the main campus, but we've also expanded quite a bit over the past few years, where we have some extension centers as well, such as in Wilson County, Bedford. We have a freestanding children's hospital and some other sites that we see satellite, such as Murfreesboro, Clarksville. We have some sites in Franklin. So we have a huge coverage area, and we're lucky to get a diverse set of patients from all over the Tennessee area, and also some of the adjoining areas as well, which was really beneficial, particularly during the COVID times, that we were able to extend care beyond our Tennessee borders to patients in the outside areas as well.
Excellent. Well, it's great to have you be part of this. And yeah, you're a fan of mine. Nobody's perfect, but I've followed what you've done for a long time. It's great to have you be part of this with us, and explain to us a little bit about yourself too. Who are you, and what is Authenticx?
Yeah, so I am the founder and CEO of Authenticx, and we are a conversational AI platform that was founded in 2018. And our whole purpose in life is to help healthcare organizations listen at scale to the everyday conversations that flow in and out of the healthcare system. So think of those call centers that might be handling billing or scheduling or nurse navigation, any kind of pharmacy related interactions. Those are the types of conversations that we're listening to by the hundreds of millions, and providing insight back to the healthcare organization around where patients are getting stuck and where they need help.
How did you decide you wanted to start that?
Well, I had been a veteran of the healthcare ecosystem for 20 years, and in many of my roles, I was managing care coordination and care management teams, as well as kind of traditional customer service. And I became really clear from listening to those conversations with my own two ears that there was a lot of things within those conversations that could add value to the broader healthcare enterprise. And so I just knew that there was an opportunity to not only improve healthcare business operations from listening at scale, but also patient outcomes. And so I just set about the work of trying to build technology that could help do that in an effective and efficient way.
That's awesome. Amy, it's been great to watch Authenticx grow, and it's great to have you here now. We've got half an hour. I'm going to be respectful of everybody's time and get us out on time, but we've got a great conversation here. And I will mention before we get underway, everybody who is registered for the webinar will receive copies of the audio and video recordings via email after it's over. Dr. Yaa, I'm going to start with you, and Amy, go to you. I'm going to ask you both. Y'all are so experienced. What are some of the greatest advances, and correspondingly maybe where some of the greatest opportunities are with applying conversational, what I call conversational AI, but maybe more broadly, conversational data and intelligence to healthcare? What's top of mind? And Dr. Yaa, I'll start with you.
I think some of the things that we're starting to see emerge and intercalate into our workflow are ambient scribe workflows where the patient and provider are with each other in the room having a conversation. And instead of the provider turning away to the computer to document all the words they have to say, there's an intelligent device that's able to listen to the conversation, capture the transcript, and then bring back a clinic note for the provider, but also interpret it in such a way that the patient can have access to as well, so they can better understand what's going on in their care. I think that's one of the more exciting things that's coming out of a lot of the conversational tools that we are seeing and experiencing. Opportunities that certainly exist just include making the way we ask our questions and have them understood be a lot clearer and a lot more concise, because we've all had those experiences where we're trying to call and go down a decision tree and it's just not the most pleasant experience. You're like pressing 0 because you just want to get a human. And as these tools get better, I think there are going to be a lot of opportunities to make that experience better, so that we can help give people the information they need and save them the time of having to be on hold and wait to just find out something that's more straightforward.
Yeah, just to piggyback on that before I ask Amy the same question, I mean, I have been the recipient of healthcare more than I wish that I had. And, going back and trying to find records or trying to know the right question to ask and trying to do any sort of forensic work yourself is really hard. Part of my hope, just to piggyback on some of the vision that you were painting there, is that from maybe an AI agent point of view, hey, go find all my medical records, just that simple, and bring them back, and that would be nice, wouldn't it?
I love it. And like you mentioned, knowing what questions to ask, like, hey, I'm curious about this condition, or I heard about this, I'm reading a little bit more about this. What are the best things I should ask my doctor based on what you know about me? So it having that contextual awareness of who you are, what things you've been through on your medical journey, and being able to bring to mind some of the things that you can have a thoughtful and informed decision conversation on with your provider, I think will just make the entire experience great for the patient, but the provider also. Like, we want our patients to be well informed, and we want them to feel comfortable and know that they're getting the care that aligns with their values.
Well said. Amy, I'm coming to you to ask the same question. So
Yeah.
you've been in the space a long time. The work you're doing is really interesting. What do you see as the greatest advances and maybe the greatest opportunities arising from that for broadly conversational data and intelligence?
Right. Well, I love what you all are talking about with regard to education and the patient being able to have a much more comprehensive set of recommendations going into visit with their healthcare provider. I think one of the things I'm excited about is the ability to pull together clinical experience data between patient and clinician, as well as their experience outside of the four walls of a healthcare setting. It's just clear to me that from conversation data on the administrative side of the experience, there's a lot that's being said in a billing interaction or a scheduling interaction that can have immense impact on the clinical care. For example, we found a great deal, about 20% of patients who are talking to a billing line or a customer service line are actually talking about their clinical care. And there are sometimes nuggets in those conversations around social determinants of health, or aspects around whether or not the patient intends to follow their discharge plan or their care plan, that could be really elevating that administrative interaction into being a contributor to the care itself. And so I see an opportunity using this data to bring together the administrative and the clinical sides of care in a much more real-time way that will allow for more holistic intervention and treatment.
Yeah, I like that too. So, I mean, it's interesting. You know, I grew up in an environment where it was normal to challenge this cost or negotiate this bill or things like that. And I'm not just talking healthcare specifically, although that was included. And, the idea of, again, having some sort of AI involvement that, especially for people who don't, you come to healthcare, you're already two strikes down because you're in need of care. Like, you've got other priorities. And for people who maybe aren't in that, mindset, or maybe who haven't, aren't at a certain educational level or whatever the case is, maybe they don't even know you can negotiate the bill. Maybe they don't know you can negotiate a payment plan, or any number of other things that not only would make it possible for them to receive the healthcare they're looking for, but also reduce stress and make it more likely it works. So that, part of what I hear you saying, Amy, it would open the doors to things like that.
Absolutely. Absolutely. I think there's so much opportunity for patients to be assisted as well as providers in the world of conversation data. I think about conversation data as being the fertile ground where there's leading indicators of things that we have lagging indicators to detect when it's too late. I also think in healthcare, we've done a lot in terms of advances of, using structured data to predict healthcare outcomes like lab data, claims data, et cetera. Conversation data is where expressions of intent and behavior lives. And so this idea of being able to combine structured data sources with the unstructured data of conversations is really exciting.
That's great. Yeah, no, I appreciate that. So I'm going to go in reverse this time to ask you sort of a question up from that, which is about implementation and execution. So, Amy, what I see on a daily basis with AI companies is, um, there's three pieces to the puzzle of trying to work with somebody. First, they got to trust you, and that's not trivial, because to allow this technology to come in, it's in the media every day for a lot of bad reasons, sometimes, and you know being trustworthy, in the eyes of a large corporation, that's a hill to climb. But assuming that you can achieve that, then there's a question of what's possible, and explaining that, figuring that out on behalf of a client, what's possible. And then one step from that is the phasing of it all. What should you do first? What should you do second and third? And how should you scaffold it all? So my question for you is, how do you think about uh, implementation? How do you bring a strategic approach to implementing conversational AI inside of healthcare?
Yeah, it's a great question. I'm so glad you're bringing up implementation because it has so much to do with change management within these large, complex organizations within a very complex industry. And we're talking about lots and lots of human beings that are impacted, right, by this, by new technology. And from our experience as an AI company working in healthcare, it is no easy feat to implement an AI tool, especially when there's pressure from C-suites or shareholders that it's going to deliver an ROI within days or months, right? And so it is kind of a dizzying task out there. And what we've found as a really important best practice is to first start with the why. What are the business goals that you're trying to achieve? And then in the world of AI, there's not just one tool, right? There's traditional NLP, there's machine learning and deep learning, there's generative AI. And we believe that there's not one tool for a job. There's multiple tools, and we have to align the tool with the job and make sure that we're not throwing, a solution out there before knowing whether or not it has a chance of actually driving impact. And we've learned a lot about kind of the importance of human beings being aligned on expectations, as well as making decisions around what they want the AI to do. That is sometimes the hardest part of an implementation. Once we have strategic alignment and everybody's on the same page, then deploying the technology is almost the easy part. So we've learned a lot about being very consultative and educational in our process, and making sure that everyone's kind of lined up with what they can expect in terms of outcomes.
No, that's great. That's a great answer to that. And Dr. Yaa, I'm going to ask you the same sort of questions. So this is a long time ago, probably 15 years ago. I sat in on a talk that the CFO of Vanderbilt University gave. And I don't remember much about that talk, but I remember he was asked a question and ended up speaking at some length about the number of vendors that approach Vanderbilt University for all kinds of reasons. And this is 15 years ago. This isn't, now, in the wake of AI. But, my question for you is similar. How do you think about implementation, specifically, like when you look at AI companies from your point of view? What do you see? What do you look for? How do you assess authenticity, ability to execute, and overall trustworthiness? And then how do you think about layering those tasks in for your team?
That's an awesome question, because I think what's interesting about Vanderbilt and a organization like Vanderbilt is we're an academic medical center, and we also have a large informatics department as well. We initially had our own homegrown electronic health record, and recently transitioned to a vendor product. So given some of the changes and improvements and growth that we've had, there's had to be a lot more scrutiny of the tools that we use to deliver care. There are a lot of considerations for data privacy, data safety, data breaches. I think as Vanderbilt's increased in profile, funny enough, again, just during COVID, when a lot of our top researchers were featured a lot, the amount of cybersecurity threats and attacks increased substantially as well. So those are just baseline, some of the most important considerations that we take into account. Just the architectural integrity of the platforms that we are evaluating. But then also, you mentioned trust and being able to understand what the values and the goals are of the team that's involved in delivering the tools and what direction they think we're going. What's neat about a place like Vanderbilt that has an active informatics department is we are open to doing explorations, even with small teams that are not the multi-million-dollar behemoths in the room. If it's clear that they're interested in the principles of evaluation and study and improvement. And we do a lot of research on informatics and informatics implementation to understand what are the outcomes that we should hope to expect and how would you measure that. So it's possible to work with even smaller vendors to say, well, let's take a look at something like this, not as a full implementation, but just to see what kind of implementation would look like and what outcomes in this period of time as a pilot to see if it moves the needle, to better understand if this is something that would make sense for an organization like ours. And certainly vendors with reputations and that have done a lot of other integrations with the services we use will be evaluated to the same degree of scrutiny. Because at the end of the day, AI is very promising. It's, there's a lot of excitement and hype. I am the conductor of one of the hype trains. I have to say, I love this stuff. But we just sometimes see a lot of people just, kind of pencil in the word AI just to give an existing tool a little more profile. And it really begs to understand, what is this doing different or better than what existing tools are? Sometimes a regular algorithm, sometimes just linear regression will get you the answer you need just as well, and with less expense than a fancy generative model. And I think it's important to have someone like an informaticist be able to have discussions with the vendors to understand whether they have that same understanding as well.
Yeah, that's great. Yeah, so I was just reading something last week on a plane flight back about how, in essence, people, and this is strictly in the United States, but people who put AI in their LinkedIn profile 3 years ago are much more likely to be at a promoted status in a mid-sized to larger organization than those that didn't. I just looked at that and I thought, I just kind of groaned, you know. And I know full well that companies that put, you know, AI this and AI that in their pitch deck or slide deck for venture purposes are much more likely to get funded. It's been that way for some time. So there's a bunch of you know, we all love the hype train, but you know, there's a lot of hype trains running in parallel, you know.
Yes.
We want to be on the one going the distance. So no, that answer is great. And so I want to take the last bit of the time we have, and Dr. Yaa, I'm going to start with you, and then Amy, I'm going to close with you. I draw a lot of parallels between this time we're in right now and the Alexa, Google Assistant, Siri, the Ascendant voice assistant era of about a decade ago, because I see a lot of parallels between the two. Healthcare is an interesting part of that, because during the previous era, we saw a lot of enthusiasm, we saw a lot of willingness to experiment, but things always hit the same wall. They crash in the same reality of, well, the intrinsic forces at play in this industry, they don't really require us to do this, and we don't really have to because our competitors aren't doing anything, so we're not going to. And things sort of stayed in that experimental phase, if they progressed even to that. Now it's very different, where it's a different environment. There's different functionality and use cases that are unlocked. It's a lot more potent, and it's clear that, you know, these health systems are, you know, players in the healthcare industry are looking around and they're seeing their competitors doing stuff. So it's a very different landscape. My question for you is, and I'll ask Amy this too to close, what is the biggest challenge that you see? We talked about enthusiasm, we talked about opportunities. What's the biggest challenge you see, either for you personally within your team at Vanderbilt or just broadly, to adopting more AI, being able to better utilize conversational data and intelligence, all of that in your field?
I think one of the biggest challenges is really understanding and creating the best benchmarks that we have to say something is good. Because there are a lot of things coming out, things change weekly, neck-breaking speeds. It's exciting to be in this field at this time because, like you mentioned, there was a lot of excitement and energy, then things kind of stalled. There's been kind of a new unlock where our imaginations are free to run wild again to determine what's next. There's a risk of being an early adopter and getting excited about these things because sometimes things don't always play out the way you see them. But at the same time, there's this camp of folks that just, you can kind of see beyond the horizon, say like, oh, it could be this, it could be that. And being able to have that vision for where we could go, but being realistic enough to know when something is not ready is a really, really, really important skill to try to hone as an early adopter that I'm still working on, because I'm still waiting for my fancy Alexa and my Apple Intelligence, but I'm like, they're fine. But we know that, the general public, like, it's going to take a little bit more than that. And just because I'm willing to say, like, this is fine, this is cool, I know where this is going, might not be enough for, my sister, my mom, or even my husband. And being able to understand what an actual standard user will need and where it needs to get to be good, not just fine, but good, I think is an important thing we need to be able to establish as the early adopters, as the people who get excited about this technology, so we can appropriately vet the ones that are being presented to us to say, this is not just exciting, doesn't have just potential, but it's actually good and ready.
I love that. Yeah, just a focus on metrics. Yeah, that's great. Amy, I'm going to come to you and give you the last word. Your thoughts on the biggest challenge that you see in front of the healthcare industry broadly, or a specific part of it, to better adopt AI.
Yeah, I think currently we're seeing a lot of hurry up and wait. And what I mean by that is there's a strong desire to unlock the promise, so to speak, of AI and to see the results. But there's also some brake slamming, and rightfully so, right? From AI governance teams and compliance and security teams wanting to make sure that it's done and purchased, procured, and deployed with the highest degree of standards, and with kind of hints of regulation, but not a lot of regulation out there. It's a bit of a quandary to figure out how to how to work and act with speed while also doing so with the highest standards of privacy, security, et cetera. So we see a lot of that happening right now, which is a challenge for such a kind of a risk averse industry. I would also just mention that I think more holistically than the healthcare ecosystem, just broadly, I see a lot of kind of humans, workforce, kind of a little bit confused about what their role is in relation to AI. There's obviously a lot of questions around job security and that kind of thing. And I think I see a real need for kind of the average consumer and or average worker, whether they consider themselves technical or not, to do a lot more education and demystification of AI, so that we can all start to feel comfortable with it as a tool and to start to think about it as a tool, and start to think about how we need to elevate our own role as humans in interacting with that tool. And I hope that we can be a part of leading, what it might look like on the flip side of this hype cycle to have a healthy and transformational relationship with AI.
Well said. Amy, we appreciate Authenticx. Thank you for putting this on. And if you didn't hear me say it earlier, every registrant of this webinar will receive copies of the audio and video recordings of it in your inbox at some point in the very near future after it's over. Dr. Yaa, it's always a pleasure to see you. And, I learned the other day what Vanderbilt is charging for undergrad tuition, and I see where the money's going. It's nice that they built a great facility for you there.
Indeed, just render it on command, actually.
Thank you very much for joining us. I'm Bradley Metrock for Project Voice Capital Partners. Thank you for joining us as well. Keep an eye out for the recordings, and until next time.